Alyssa, and I'm going to be doing a Graysby pump PCA. So I'm just going to start off by doing my checks here with my physician's order and my MAR here. So I'm just going to check that it's the correct patient. It's Marcy Paris. VIN number is 123. VIN number 123 456 456 789 789. So that's correct here. So the morphine is 1 milligram per milliliter PCA dose. We're going to be giving it via a PCA IV. I have my morphine here. It's 1 milligram. It's 10 milligrams per milliliter. I need 5 of them here. And I'm also going to be looking at the recipe in the PDM here. So we're going to be doing a PCA. So I'm going to go to the PCA rate and dose. So rate is 1 to 10 milligrams per hour, which I have here. And we're going to draw 50 milligrams, which is 5 times 10 milligram per milliliter, 1 millampules in 50 ml syringe. We're going to add 45 milliliters of D5W, normal saline or dextrose saline combo for a final volume of 40 milliliters. And then the final concentration is going to be 1 milligram per milliliter for the PCA use. Fair. So I'm just noting that I have the morphine here. It's 10 milligrams per milliliter. I need 5 of these ampules. So in practice, these would be closed, and if that, I'll just get a cleaner one and make sure I'm maintaining aseptic technique. So I double checked that the compatibility between morphine and normal saline was okay, and it is. So I'm just going to quickly go to my recipe once again. And I confirmed with the physician's order and the MAR that I'm using the rate of 1 to 10 milligrams per hour. And I am going to begin starting up. So in practice, I would be using a blunt fill needle, which I have to grab one moment. 100 milliliter mini bag. So I have a 100 milliliter mini bag of normal saline, and it is normal saline. So now I'm going to get that ready. Hygiene. So I'm going to remove 45 from this normal saline here and put it in this syringe. And I'm just cleaning for 30 and letting dry for 15. This would probably be too much air to shoot in there, so I'm just going to remove. So I am noting that this is a high alert medication, and I would, after my second check, be getting a second nurse to confirm that I pulled up the correct dose. So these have been used a couple times in practice. This would be a full 50 ml normal saline bag. So we'll see if we have enough normal saline in here to pull out. Okay. I'm just pulling back 5 in order to. And I'm going to cap this for right now, and I'm just going to write so my second nurse knows what this is. It's 45 ml normal saline. Okay, so I'm just going to label this here. Okay. Now I'm going to drop my medication. And I need another blunt fill. So I'm going to draw up 5 ml of morphine here, and I'd be using a filter blunt fill needle. Draw up 1 milliliter. I have 1 milliliter, 1 milliliter, and I also have my 100 milliliter mini bag of normal saline here. Now that I've done my second check, I'm going to have a second nurse come in and verify independently that they have their, that they agree with my reconstitution here. Once they confirm that it's good, I'm now going to inject my medication. For 30 seconds, I'm ready for 15. And I'm just going to finish my last one. Okay, so I have, and I'd be doing this over waste disposal. My new label, I leave this capital regulation straight at morning. So I have, this is over waste. 5 ml of morphine, which is, and then I'm going to be recapping this, and then switching to a blunt fill needle that is not a filter needle. And then I'm just going to label this here that this is milligrams of morphine in 5 ml, which equals 5 ml. And it's for patient Marcy Paris. So before I inject this medication into the normal saline, I'm just going to do my second check. So I'm going to be checking that it's the correct patient, Marcy Paris. Marcy Paris. I don't need the physician's order. So actually, before I do this, I'm just going to create my full label for Marcy Paris. So Marcy Paris. We're drawing up morphine. The dose is that the doctor ordered to be delivered is 1 milligram, and the volume is 5 ml. The dose is 1 milligram per bolus, but the entire is 50 milligrams within 5 ml. And we're going to dilute it in 45 milliliters of normal saline for a final concentration. Final concentration of 1 milligram per milliliter, so 1 milligram per milliliter. And the date is March 13th, and we're giving it now. And I'm going to put my signature and my designation, but also leave a section for the second nurse to do it as well. I'm going to put the PCA bolus is 1 milligram, and the lockout is 5 minutes, which equals that the patient can get 12 boluses an hour. Per hour. Okay, so now I'm going to do my second check. So I have my 45 milliliters of normal saline here. It's for patient Marcy Paris. Marcy Paris. We're going to be giving 50 milligrams of normal saline, which equals, so we got the normal saline here, or sorry, the morphine. So we got 50 milligrams of morphine, which equals 5 ml. And we drew it from here, which is 1 milliliter, and it's 10 milligrams per milliliter. So that's correct according to our doctor's order, as well as to our PDM. That's correct. We're going to be giving it now. We're going to be giving it via a PCA IV route, and the correct drug is morphine. So now I'm going to get my second nurse to come in and do her check. She did her second check and she says that everything is okay. So now I'm just going to pull back and I'm going to release this and take off this lid and aseptically inject this medication that my second nurse said was okay into the normal saline here. And I'm just going to, this is going to go into Sharp's disposal, and I'm just going to prime this tube here. Okay, and I'm at 50 ml, which is correct according to our PDM. Now I'm going to label this here. But you're not refusing, so I will also continue at this moment as well. And I would have performed hand hygiene prior to injecting this. So I just put my label on here, and I'm going to go into the room, perform hand hygiene, and introduce myself to my patient. There would be a cap on the top of this, just to make sure that it's correct. So, oops, okay, hand hygiene. Hi, can you please tell me your first and last name? Okay, Paris Marcy, 12345, 12345. I'm going to start setting this, and then my buddy nurse is going to come in, and she's going to make sure that the correct medication was set. I wouldn't have dropped that. I'm going to pick this up. I would maintain a aseptic technique while doing so. Okay, so I would start programming this. Okay, it's testing. So I'm just doing my other check. So Paris Marcy, she verbalized her name. She gave me her fin. Okay, so I have to change this. Oops, it's 1 microgram. We have to toggle. Crap, how do I do this? 1 milligram, how do I change the milligram? Crap, how do I change it? Oh crap. Okay, I was just looking at the commands. Sorry, I'm just trying to program this. Stop on this. Okay, well I need, maybe if I go. For 30 seconds and try. Okay, 5-minute lockout. Okay, 5-minute lockout. Okay, enter. I need to go up to 1 milligram. It's saying it's in micrograms. This is incorrect. We need it in milligrams. So I'm changing to milligrams per hour. Selecting. Okay, checking syringe. Okay, we're gonna go enter. Down. Crap. 1 milligram per hour. Bolus dose is going to be 1. And I told the patient that they, in order to make this PCA work, oh, enter. Enter, yes, correct. Yes, we're not having a continuous infusion. We move down to 0. Okay, press. And my second nurse came to check this to make sure that this was correct. We're going to start. We're going to, she looked this over, so she ensured that the dose was 1 milligram per bolus, that there's 5 milliliters in here, that we're giving this IV, that the IV site was correct, and that the lockout interval was 5 minutes, and we're giving it now, and we're going to start. I would lock this and ensure that the green button was, the button was pressed and that it was green. And I'd cover and press start. So I tell the patient that every time that they needed pain medication, they have to press it, and that this green light will go, and that I'm going to be monitoring for pain and to see how their pain is. And I'm just going to tell them that only they can use the pain medication and no one else can press it, and that I'm going to be reassessing. And they gave consent to this procedure. My second nurse came in and did their check after my third check, and they confirmed everything was okay. And I'm going to document when this medication was given.